Yes. I want to talk about Charlie Gard. He's the terminally ill baby in Britain. Joining us is Dr. Marc Siegel. Doctor, welcome to the program.
Good to see you, Stuart.
Now, in Britain, socialized medicine, that puts the government in charge of the treatment of a child. Very different, I think, from America, which is more of a private enterprise system. Have I got it right?
Yes, you do, although I don't want to say that there wouldn't be times when the government would try to intervene in cases,
right.
And a lot of times they're wrong. In this case, the parents should be in charge of the child. Here's how I define my role as a physician, and this is relevant. I'm either supposed to relieve suffering or prolong life, not the government's role to decide that a life should end. Now, physicians try to prolong life, but sometimes when we're relieving suffering, we end up bringing about the end of life sooner, if it's severe suffering or pain. In this case, the baby is in some discomfort, suffering from a disease where the engine of the cell is affected, and there's been a lot of brain damage. But if you start making government rules, and this is your point, government starts marching in and deciding when to end life, that takes away the role of the parent, of the patient, and of the physician, and it's totally wrong.
Now, in Britain, the parents have gone to court. They want to take that child, bring him to America for this special experimental treatment. The government in Britain says that special experimental treatment will be painful to the baby. Therefore, they want the baby to stay in Britain. They want to let it die in Britain. That's what they're saying. You totally oppose that?
Well, I oppose that, and I want your viewers to understand that this treatment has prolonged life in some cases.
It has.
It has. The mitochondria, which is the engine of the cell, is deteriorated, is not working. This enables it to work again. The problem is it won't fix the brain damage the baby already has. It's not going to bring about a cure here. It could prolong the baby's life, and I don't agree with the government here that somehow the baby's in agony and they have to end the agony. Now, again, here's a role of government that works, Stuart. If a family refuses emergency treatment, let's say, they say, religious, I don't want to give a transfusion, I don't want an operation, sometimes I would want to intervene to save a life. In this case, I don't think the government has a proper role here, and I don't think they in any way should get in the way of experimental treatment. You know, what happens if something comes down the line? You keep a child alive longer, and then wham, an experimental treatment comes along that actually does work. Won't be likely in this case, but that's where the slippery slope is.
Let's not forget that the parents of Charlie Gard, the little baby, they are prepared to pay for the treatment in America themselves. They're not going to be a charge on the British government. They'll pay for it. They'll pay for American treatment. Now, let's suppose that this baby had been born in the United States, and the insurance company was asked to pay for this experimental treatment. If the insurance company refused, then the parents would simply take the child, and if they could pay for it themselves, go treat him elsewhere, and that would be the end of it, would it not? That's how it works.
And several hospitals here in the United States have agreed to offer this treatment to the baby. Absolutely. There's no role for government in this, and I think it's a very, very stark case. It's a right or wrong case. Again, it's not that there's no role for government ever.
Of course.
There's a role for government sometimes if there's a lot of suffering involved. And I also believe, and you may not agree with this, there are times when I might pull the tube. There are times when I might say that that's okay. This is not one of them.
Okay. You're on the parent's side in this case.
Hugely
Bring
on the
him
parent's side. Bring him here. Get the government out of this. And you're right that it's an issue of socialized medicine. Too much government control over health care. We got too much of it here already.
Well said. Dr. Marc Siegel. Thanks for joining us, sir. Appreciate it.